My name is Edgar Kalimba. I'm a pediatrician and a pulmonologist, so I deal with respiratory diseases of children. But I'm also the Deputy Chief Executive Officer in charge of medical services. And here at King Faisal, and in the broader context, King Faisal, or through King Faisal, we initiated the Africa Health Sciences University in collaboration with the Ministry of Health and the other government entities as part of the contribution to workforce development, the health workforce development, or the 4x4 that you are aware of. So we are a specialized hospital, but we are also a teaching hospital. So we have dual or even triple mandate to provide specialized healthcare services. Especially our role, one of our roles is to reduce the gap in specialized services in the country that create a need for Rwandans and residents to go and seek medical care out of Rwanda. So we are mandated to close that gap together with other hospitals, other tertiary hospitals. But we are also mandated to teach a big hospital that has quite some infrastructure and facilities. Part of our mandate is to teach medical students, specialists, others that we call fellows who are specialists and sub-specializing in different areas and disciplines, but also in nursing, midwifery, and other allied health professional areas. So that is the broader scope of us as King Faisal, together with Africa Health Sciences University. Yeah, so we were extremely grateful that the government helped us to get this land in Rusororo. So it's a good sized land. And the plan really is to, again, it's within the broader perspective of the government's commitment to improve healthcare. And, you know, when you talk about healthcare in general, yes, there is infrastructure and facilities, and actually that is a bit easier to do. But when you talk about skills, that is the limiting factor virtually in every country in the world. I don't know of a country that has sufficient skilled medical personnel, and even more so for us as Rwanda, a country that is developing and trying to cover gaps very quickly. So the broader commitment of the government to provide infrastructure and workforce development is within this context of the land they gave us. That land is earmarked to develop a future campus for the Africa Health Sciences University. And we only got the land now, so we've only started to work on the strategy for the campus. But what I can say for now is that it's going to be a comprehensive campus, meaning it will have all the facilities that are necessary for workforce training, for as a medical school and a teaching hospital. But it will also be a global or an international medical school. So the ambition is very high, the standard is going to be very high, and it's going to be really comprehensive, starting from undergraduate to postgraduate and all the other spheres of training and research. We don't have the details yet, but I don't know if you've had a chance to look at our hospital expansion that is under construction. King Faisal is undergoing a major expansion. We are actually we are going to triple our current capacity in every way, and we're going to have all the specialized services that were non-existent in the country before. So, and this is a state-of-the-art infrastructure. And the AHSU, or the Africa Health Sciences University Future Campus, is not going to be less. So that is the direction, but we don't yet have a lot of information that I can share right now. It's definitely in the next 3 to 5 years. There's a lot of work that needs to be done before that, but plus minus in the next 5 years, we hope that that campus will be ready. So we need to work very fast. So Africa Health Sciences University started actually last year. So we are already running, we are already operating, and we had our first intake in September 2024. And we started with what we call residency programs, which is general doctors specializing in different disciplines. And then we have a school of midwifery, because one of the areas that as a government and as healthcare providers, all of us, that we need to work more on is maternal child health. So we need more midwives. So at the moment, we have the first cohort that is actually going to their second year next month in September. And then our second cohort is starting their first year again in September in a couple of days. So we started with 6 programs with regard to the training of the doctors who are specializing, which is pediatrics and child health, obstetrics, gynecology, general surgery, anesthesiology, emergency medicine. So we have 6 programs, 6 different specialties, and then we have the School of Midwifery. And that is ongoing. So we expect to graduate our first graduates in 2028. Because with medical training, everything takes a while. Most of the residency programs take 4 to 5 years to complete. And now our first cohort is beginning their second year of training. So 2028, we'll have our first graduates of 60 specialists and 40 midwives. So it's about 100. Within clinical training and clinical practice, there's different ways of doing PhDs, because remember, if medical training from undergraduate to becoming a specialist, it's already 10 to 12 years. So it's a long training, and that's why it's a bit of a challenge to train good numbers in a short time. It takes a while and it's quite costly. Now with PhD, because one of our core focus areas is to develop research, encourage research, and make sure that doctors actually participate in research that responds to our contextual problems. And that's why PhDs are important, because PhDs are research-based. And there's 2 ways. So we have a couple of doctors who are already specialists who do their PhDs in different areas. But we are also thinking that in the next couple of years, 2 to 3 years, once we start our undergraduate program, because right now we have a postgraduate program. So once AHSU opens the undergraduate program or the MD program, general medicine, we are already thinking and conceptualizing how to have what we call an MD PhD track, where somebody can graduate as a young doctor, but also as a PhD, because it adds value in terms of capacity, in terms of broader skills in research as well. So that plan is there. We already have a few people doing their PhDs, because we'll need faculty that can help to run the program. So at the moment, all the residents, the doctors specializing in AHSU are actually sponsored. But they also have to sign a retention, what we call a retention contract with the Ministry of Health. So that after their training, they have to serve within the public and teaching hospitals for at least 5 years. So that's kind of their way to pay back for the sponsorship. And that's also a model that is already in place for other universities here in Rwanda under the Ministry of Health. They have to sign a retention contract. However, we already have a few trainees who are from other countries, and we want to grow that, and there will be a fee for that because this medical school is actually not just for Rwanda, it's an African medical school, and we want it to grow into a proper international school. So we're going to be taking trainees and applicants from different countries, and the number is growing actually when we look at the statistics. And those will have to pay because eventually the university also needs to be sustainable long term. A lot has actually been achieved, even though we're still a young university, a young medical college, because through partnership with the Ministry of Health, we have other teaching sites. So, for example, for the residents or the medical specialization programs, we have Kibuye Hospital and we have Chibungo Hospital. They are also our teaching sites. And for them to be our teaching sites, a lot of work needed to be done, not just in terms of the hospitals to be upgraded, but also the staffing. So we had to deploy 30 faculty or specialists in different areas for them to teach and supervise our residents while they rotate there. And what that has done is, first of all, the number of doctors improved in those hospitals. So that actually reduced. We are currently looking at the details and the impact, but that reduced the need for referrals from those hospitals to the tertiary hospitals. It definitely improved the care being given to the patients in those hospitals. And also it elevated the hospitals as teaching sites. And there's many other achievements in terms of, because when hospitals incorporate teaching and research, it elevates generally how the hospital works. It improves the quality of services. We do continuous medical education. We have obviously highly qualified specialists. At King Faisal, we have about 150. And adding those other teaching sites, it really makes a huge difference, the entire spectrum, in terms of patient care, in terms of teaching, and in terms of research. But also for the midwifery school, we have other hospitals, Kachiru, Muhima hospitals, that we are working to improve the infrastructure, and also use them as our teaching sites for the midwives. Yeah, so I mentioned the 6 medical specialization programs or the residency programs: internal medicine, pediatrics, obstetrics, gynecology, general surgery, anesthesiology, and emergency medicine. And there's a reason we started with those, because most patients are managed within those specialties, so that has the biggest gap. However, we have other programs that want to start. For example, radiology and medical imaging in the medical area, but also in the nursing and midwifery area. We want to broaden the nursing specialization programs. We also started other smaller programs. So, for example, there's something called perfusion or perfusionists. So we've started a cardiac surgery program. It's been a while now, a couple of years now. And, you need a surgeon that operates on the heart, but you need an entire team around him, of course, anesthesiologists. You need, of course, nurses who are properly trained and specialized to work in that highly demanding specialty. But you also need people that are called perfusionists that actually run what we call the heart-lung machine, the pump machine, where the bypass machine. So these are other programs that are previously non-existent in Rwanda. Skills were not there, but we are working to establish these and other programs to close the gaps within the whole spectrum, not just to focus on the doctors and the midwives, but to focus on the entire spectrum. And of course, there's other teaching sites as well. And for example, we are working with the University of Rwanda to start fellowship programs. This is like subspecialists. And there's already a good number of them that have started the past few years, and we're starting even more as we go along. So there's a big gap, but we are actually working progressively and quickly to close those gaps, because the most sustainable way is to actually train people in the country instead of sending people abroad. When we train our own people here, it's more cost effective, it's more sustainable, and it's less disruptive, because when people are being trained, they're also giving services. And that's why as we want to keep adding more programs, obviously in consultation with the Ministry of Health and other government institutions. We have many partners virtually on every continent, other medical schools, teaching sites that have bigger centers than us. And one of the things that I can mention is that all our residents and fellows who are in training will undergo what we call an external rotation, meaning at some point in the course of their training, they go abroad based on what specialty they're training in, and they spend a couple of weeks to months observing the bigger centers. Some of them have more capacity, and learning from them. We already have partnerships with the in-country schools. So for example, we work a lot with UGHE on research and clinical trials. There's dual projects we're working on together. And in terms of other places in the US, I could mention a couple of universities that have actually been supporting us on different programs. So there's the University of Michigan, there's Duke University, and there's other universities that previously we were already working with the programs in the University of Rwanda and with the Ministry of Health, and we're actually broadening them. And we keep growing, and we have other universities in India that have also been, and teaching sites and hospitals that are hosting our trainees. Of course, there's always challenges, and within health workforce development, skills are really like getting faculty in all the areas is one of the challenges. But with the commitment and support of the government of Rwanda and other partners, we've been able to close most of those gaps by hiring faculty and expatriates. So we have quite a sizable number of expatriate specialists in different areas that give services to patients, but also help us to teach and train within our programs. The other things, of course, are infrastructure, and that's why there's a big push for infrastructure. We have the hospital expansion that is ongoing, and we have the new campus that we're going to be working on quite intently the next couple of months and years to develop it. And sometimes we don't remember how cumbersome it is to train a doctor. It takes many, many years. You need about 10 years to graduate a specialist. By the time they are done with the 5 to 6 years of undergraduate, and they add 4 to 5 years of postgraduate training. That's more than 10 years. And, if you look at the World Health Organization recommended doctor population ratio, and I'm not even talking about health care provider population ratio that include the nurses, the midwives. If you look at just the doctors, we're supposed to be having 1 doctor per 1,000. And we're still much higher than that in terms of 1 doctor to population ratio. So we have a big gap to close. And our population is also growing. We have maybe 300,000 children born every year. But the rate of training takes many years. And that's why the government is employing multiple measures to quickly close this gap, or at least reduce it significantly. And that's where we come in as AHSU. The challenges are there, but they're not insurmountable. I think we are generally, progressively overcoming the challenges as we move forward. So the construction is ongoing. With these big projects, it's not always perfect, but we're making progress. The goal is to have the new hospital ready and open and operational end of 2027, early 2028, which is pretty soon. Building, equipping, and commissioning a hospital that is going to be accredited internationally. It's a big task, but we are making progress. And because King Faisal is now the main teaching site for the Africa Health Sciences University, it means we'll have 3 times the current capacity in every way, in skills and specialties, in equipment, diagnostics, and infrastructure. So it means that we'll have a bigger, broader, much better environment to train and to provide specialized services. We have big ambitions as a country. We need to provide in-country medical services as broadly, as comprehensively as possible with the highest quality. And not just that, we also want to be a hub. Rwanda wants to be a hub in different areas, in different services and sectors. And it's the same for healthcare as well. Instead of people having to travel overseas from within African countries, why wouldn't they come to Rwanda and be given equally good services that they would get from elsewhere? So this is an ambition, it's a goal, and the government has put in place already many things that make it achievable. So I think broadly, with the new campus, with our hospital expansion, with the new campus for Africa Health Sciences University, the goal is to cover all of that, provide good services, contribute to medical tourism and teaching, capacity building, workforce development, and research, because research is very critical in terms of teaching and training in healthcare.